Next, we want to sort of move on to the next presentation. We're very fortunate to have Tiffany Bearwalt with us today from Genentech. Tiffany's a Senior Manager of Marketing Analysis and Strategy. She'll talk about Enspryng. Tiffany, please.
All right. Hi, everyone. First and foremost, thank you to the Guthy-Jackson Charitable Foundation and to each of you for the opportunity to speak today. My name is Tiffany, and I'm on the neuroscience team at Genentech. So approximately 6 months ago, the FDA approved Enspryng as the first and only subcutaneous treatment for adults living with AQP4 positive NMOSD. Today, my goal is to share more information about Enspryng. So I'll start by sharing a short video featuring real individuals living with NMOSD. Donna, Kitsia, and Kyla will share their personal experiences, including why they chose to start treatment with Enspryng.
Enspryng is a prescription medicine used to treat neuromyelitis optica spectrum disorder, NMOSD, in adults who are aquaporin 4, AQP4 antibody positive. It is not known if Enspryng is safe and effective in children.
Back when I was diagnosed, there was no approved treatment for NMO.
We tried different treatments, and I would have multiple relapses a year, and it was scary.
My symptoms were continuing to add on. Like, I was getting new symptoms, and each time I had a relapse, it was worse.
My neurologist told me about a clinical trial for a drug called satralizumab, which was specifically for NMO.
When my neurologist mentioned that there was a trial out there for NMO, I was pretty excited about it.
I was more than willing to try any kind of drug study or any kind of new treatment that was out there, because I was not happy with the way my body was.
Of course, satralizumab is now known as Enspryng. I was ready for a treatment like Enspryng, and my doctor thought I'd be a good candidate for it.
My doctor and I went over the risks and potential benefits of the treatment.
Enspryng may cause serious side effects, including infections, increased liver enzymes, low neutrophil count, serious allergic reactions. The most common side effects of Enspryng include sore throat, runny nose, nasopharyngitis, rash, fatigue, extremity pain, headache, upper respiratory tract infection, nausea, inflammation of the stomach lining, gastritis, joint pain, arthralgia.
My doctor thought that the early trial results looked promising and that he thought I would be a good fit.
I had a choice. I could stay at home in my chair, or I could try something that could potentially help me manage my disease.
So far, my doctor and I are happy about my results with Enspryng. Of course, this is my experience. Everyone's experience is different.
I felt the decision to take part in the trial was a really good one. All these years, I have had no relapses, and I'm living my life.
Okay, so before I jump into this presentation here, I want to provide a quick overview of everything that I'll be sharing with you today. First, I'll share some information about Enspryng and how it is thought to work. Next, I'll review the clinical trial results of Enspryng. I'll then walk you through how to take Enspryng, which I mentioned is the first self-administered NMO treatment you can take at home after proper guidance and training. I'll then share more about our patient support services for Enspryng, and then spend some time reviewing the important safety information. So how is Enspryng thought to work? And first, who can take Enspryng? So Enspryng is approved for neuromyelitis optica spectrum disorder, or NMOSD, in AQP4 seropositive adults. The specific way that Enspryng works is not completely understood, but it is thought to affect the protein interleukin-6, or IL-6. Enspryng is the first treatment for NMOSD designed to block IL-6, which is a protein made by immune cells in our bodies that may play a key role in the inflammation that occurs in people with NMOSD. So Enspryng is designed to block the action of that protein in your body called IL-6, which, as I mentioned previously, is believed to play a part in the inflammation in NMOSD. Without Enspryng, IL-6 connects to the cell surface via its receptor and activates the cell in that inflammation pathway. With Enspryng blocks IL-6 from connecting to the cell surface and prevents the activation of the cell. I'll now share some information and details around the clinical trial results of Enspryng. What were the goals of the Enspryng clinical trials? So there were 2 distinct clinical trials conducted to determine whether Enspryng alone or Enspryng in combination with immunosuppressive therapy or other ISTs could lower the risk of relapse in adults with NMOSD versus placebo. These ISTs included azathioprine, mycophenolate mofetil, and or oral corticosteroids. Both of these 2 trials also measured how many patients were relapse-free at specific time points with treatment with Enspryng. How was Enspryng studied? So patients from countries around the world participated in the 2 trials. A wide range of patients in terms of age, gender, AQP4 IgG status, and the severity of the disease were represented in the clinical trials. These included both men and women, with a larger proportion of women, patients who were AQP4 IgG seropositive or AQP4 IgG seronegative, and patients with at least 1 confirmed relapse over the past year. As I mentioned, there were 2 distinct clinical trials. Study 1 excluded patients who were recently taking other treatments before starting the trial, and study 2, on the other hand, only included patients who were taking certain immunosuppressive therapies, such as azathioprine, mycophenolate mofetil, or oral corticosteroids before starting the trial. Based on the number of patients who were included, Enspryng is only approved for AQP4 IgG seropositive adults. In study 1, or Enspryng versus placebo, there were 95 patients included in the study who were randomly chosen to take Enspryng alone or placebo. In regards to the detailed results, Enspryng met the main study goal by reducing the risk of relapse and resulted in more AQP4 positive adult patients who were relapse-free at 96 weeks, or approximately 2 years. What this means in terms of the numbers is that in adult AQP4 positive patients who took Enspryng significantly reduced the risk of relapse by 74% versus placebo. And more patients were relapse-free at 96 weeks, or approximately 2 years, with Enspryng versus placebo. 77% of AQP4 positive patients on Enspryng were relapse-free at 2 years versus only 41% with placebo. In the second study, or Enspryng plus those immunosuppressive therapies that I mentioned earlier versus placebo plus those immunosuppressive therapies alone, there were 76 patients included in this study, and they were randomly chosen to take Enspryng with ISTs or placebo with ISTs. Again, Enspryng met the main study goal by reducing the risk of relapse and resulted in more AQP4 positive patients who were relapse-free at approximately 2 years. In adult AQP4 positive patients on Enspryng with immunosuppressive therapies, Enspryng significantly reduced the risk of relapse by 78% versus placebo. And more patients were relapse-free at approximately 2 years with Enspryng versus placebo plus ISTs. 91% of AQP4 positive patients on Enspryng plus immunosuppressive therapies were relapse-free at 2 years versus 57% of patients taking placebo plus ISTs alone. How is Enspryng taken? We'll go through those details right now. As you can see here, we have a mock-up image of what the Enspryng prefilled syringe and carton looks like. An Enspryng treatment can be self-administered. Enspryng is intended for home use or elsewhere under the guidance of a healthcare professional. And after proper training in subcutaneous injection technique, an adult patient or their caregiver may self-inject Enspryng if your HCP or doctor determines that that is appropriate. There are numerous resources available to understand how to properly administer Enspryng. And many of these resources are available at enspryng.com, including a video with details on how to self-administer Enspryng to reinforce and refresh the techniques you learn from your healthcare provider. In regards to dosing, Enspryng is a quick subcutaneous injection given under the skin once a month via a pre-filled syringe. Initiating Enspryng requires 3 starting doses administered at 2-week intervals. When you begin Enspryng, you'll administer your initial starting dose. 2 weeks later, your second starting dose. And 2 weeks after that, your third starting dose. After those starting doses, ongoing doses are taken every 4 weeks. In regards to storage and handling, Enspryng does require a refrigeration. However, Enspryng can be unrefrigerated for a maximum combined time of 8 days. This allows you to take or administer Enspryng in a location that is most appropriate for you at the time. I'll now share some information about our patient support programs for Enspryng. Our focus on patients extends to the programs we've created to help patients get the Genentech medicine that they've been prescribed. Once you and your doctor have decided that Enspryng might be the right treatment for you, we have programs that can help based on your unique needs as individuals living with NMO. So Enspryng Access Solutions is the place to turn for answers and support. We offer a number of support services, including a patient navigator who is your personal guide throughout your treatment with Enspryng, supplemental injection training and support, as well as financial assistance to help with the cost of your Enspryng. Your patient navigator works with you and your doctor's office and/or specialty pharmacy to help get your medicine. They can explain how insurance can cover Enspryng treatment. They can also help you find financial assistance options to enroll and navigate the Enspryng copay program if you're eligible. They're available to answer questions about Enspryng and can teach you about the Enspryng supplemental injection training. You should feel supported along your entire journey and with Enspryng. So you can reach out to a patient navigator at 844-ENSPRYNG without the E, which is 844-677-7964. All of this information and the ability to enroll is also available at enspryng.com. We can also help with the cost of your medicine. Genentech is committed to helping you get the Enspryng your doctor's prescribed, and your patient navigator can help find assistance options to help you pay for Enspryng. If you have a commercial insurance plan, you may be able to use the Enspryng copay program. If you have commercial or public insurance plans, such as Medicare or Medicaid, you may be referred to an independent copay assistance foundation. And if you have no insurance coverage or can't pay for your medicine, the Genentech Patient Foundation may be able to help. There may be options that can help you afford your Genentech medicine, no matter what type of health insurance that you have. We also offer injection training support. So Enspryng clinical education managers provide supplemental injection training to patients or caregivers to ensure that they're prepared to administer Enspryng. Clinical injection managers do not inject patients with Enspryng. However, they can set up a free one-on-one virtual injection training visit and provide ongoing injection training support throughout your Enspryng treatment journey. Again, call 844-ENSPRYNG without the E, or enroll online at www.enspryng.com. I will now share some important safety information about Enspryng. As I mentioned earlier, Enspryng is a prescription medicine used to treat neuromyelitis optica spectrum disorder in adults who are AQP4 antibody positive. It is not currently known if Enspryng is safe and effective in children. You should not take Enspryng if you are allergic to Enspryng or any of the ingredients in Enspryng, have an active hepatitis B infection, have active or untreated inactive tuberculosis. The most important information you should know about Enspryng is that Enspryng can cause serious side effects, including infections. Enspryng can increase your risk of serious infections, some of which can be life-threatening. Talk to your healthcare provider if you are being treated for an infection, or call them right away if you think you have signs of an infection with or without a fever, such as chills, feeling tired, muscle aches, and a cough that will not go away, skin redness, swelling, diarrhea, belly pain, feeling sick or burning when you urinate or urinating more than usual. Your healthcare provider will check if you have an infection and treat it if needed before you start or continue to take Enspryng. Your healthcare provider should also test you for hepatitis and tuberculosis before you start Enspryng. All required vaccinations should be completed before starting Enspryng. People using Enspryng should not be given live or live attenuated vaccines. These vaccines should be given at least 4 weeks before you start Enspryng. Your doctor may recommend that you get a non-live or inactivated vaccine, such as some of the seasonal flu vaccines. And if you plan to get one of these non-live or inactivated vaccines, it should be given whenever possible, at least 2 weeks before you start Enspryng. Enspryng may also cause increased liver enzymes. Your healthcare provider should order blood tests to check your liver enzymes before and while you're taking Enspryng, and they'll tell you how often you need to take these blood tests. Enspryng may also cause low neutrophil count, which can decrease or can cause a decrease in the neutrophil counts in your blood. Neutrophils are the white blood cells that help the body fight off bacterial infections, and your healthcare provider should order blood tests to check your neutrophil count while you're taking Enspryng. Enspryng can also cause serious allergic reactions. These reactions may be life-threatening and have happened with other medicines that are similar to Enspryng. Tell your healthcare provider right away before taking your next dose if you've had hives, rash, flushing after your injection. Seek medical treatment right away if you have any symptoms of a serious allergic reaction. And before you take Enspryng, you should tell your healthcare provider about all of your medical conditions, including if you have or think you have an infection, have had liver problems, have ever had hepatitis B or are a carrier of the hepatitis B virus, have had or been in contact with someone with tuberculosis, have had a recent vaccination or are scheduled to receive any vaccination, are pregnant, think you might be pregnant, or plan to become pregnant, as it is not known if Enspryng will harm your unborn baby. You should also tell your healthcare provider about all the medicines that you're currently taking, including prescription and over-the-counter medicines, vitamins, and herbal supplements. In regards to the most common side effects of Enspryng, these include sore throat or runny nose, rash, fatigue, extremity pain, headache, upper respiratory tract infection, nausea, inflammation of the stomach lining, and joint pain. And so with all that important, very important safety information, that brings me to all I have for you today. And I know that a ton of information was just shared, so don't worry if you feel like you missed something. You can find more information about Enspryng, including everything that I just shared with you in this presentation at enspryng.com. And so with that, thank you so much again.
Tiffany, thank you very much. We'll now move into the same questions we asked before, but now specifically focused on Enspryng. So the first question has to do with, do patients need to be off of their current or prior therapy before starting Enspryng?
So we encourage you to have an open dialogue with your healthcare provider to discuss the risks and the benefits of switching to Enspryng. You may be able to continue taking your current treatment depending on which drug you're taking. So as I mentioned in my presentation, in study 2, patients taking Enspryng continue to also take certain immunosuppressive therapies during the trial. These therapies included azathioprine, mycophenolate mofetil, and or corticosteroids. Your healthcare provider will help determine the most appropriate way to use Enspryng, whether that's alone or with certain immunosuppressive therapies.
And so just to follow up on that, sort of the other side of the question, if someone is already on one of those therapies you mentioned, can they start Enspryng?
Again, talk to your healthcare provider about the potential risks of either adding Enspryng to your current therapy or switching to Enspryng. Our trial results was designed and included patients who were taking certain immunosuppressive therapies prior to and while they were taking Enspryng. And so your healthcare provider will help determine the most appropriate way to use Enspryng, whether that is Enspryng alone or with certain immunosuppressive therapies.
Great, Tiffany, thank you. The next sort of question has to do with, Enspryng, of course, is one of the approved therapies. Why is Enspryng being approved better than other medicines that might have the same target or mechanism of action, but are not approved for NMOSD?
So I cannot comment on how Enspryng compares directly to other therapies, as no head-to-head clinical trials have been conducted. However, while Enspryng and tocilizumab have the same target, they are two distinctly different molecules. The engineering of Enspryng is designed to block IL-6 signaling and be self-administered every 4 weeks. Tocilizumab is also not approved for the treatment of NMOSD, as there's no global randomized control studies to support the efficacy and safety in NMOSD populations.
Thanks a lot, Tiffany. Moving on to the risks of infection, I know you went through that pretty carefully. Could you just add any other comments you might have regarding the question from patients? What are the risks of infection with Enspryng, including PML?
There is no PML risk associated with Enspryng. Enspryng can, however, increase your risk of serious infections, some of which can be life-threatening. Talk to your healthcare provider if you're being treated for an infection, or call them right away if you think you have signs of an infection. Your doctor will check if you have an infection and treat it if needed before you start or continue to take Enspryng.
And Tiffany, you mentioned whom can be prescribed Enspryng, but could you just address this question also? Is your drug safe and effective in young adults, let's say persons who are just beyond pediatric age, say 20 years old, for example?
So Enspryng has been FDA approved for use in AQP4 positive adults who are 18 years and older. And while 8 adolescent patients aged 13 through 17 were enrolled in Enspryng's clinical study 2, the FDA determined that safety and efficacy cannot be evaluated in adolescents, given the population size within that clinical trial.
Okay, thank you. And regarding monitoring or blood work, can you just add anything to what you've already said regarding, routine monitoring or other testing that might be necessary with Enspryng, and if so, how often?
Sure. So your doctor will check if you have an infection and treat it if needed before you start or continue to take Enspryng. And they should test you for hepatitis and tuberculosis before you start taking Enspryng. Your doctor should also order blood tests to check your liver enzymes before and while you're taking Enspryng, and they'll let you know how often you need to have these blood tests. In addition, your doctor should order blood tests to check your neutrophil count while you're taking Enspryng.
Tiffany, during the injection administration or prior to it, is any pre-medication necessary to avoid adverse reactions, and is the drug well tolerated?
So no pre-medications are required before the administration of Enspryng.
Great. And then you mentioned again a little bit about this topic, but one of the questions that is important to patients: can Enspryng be used during pregnancy or in patients who have an autoimmune disease in addition to an NMOSD?
So in regards to pregnancy, there is no adequate data on the developmental risk associated with the use of Enspryng in pregnant women. Therefore, before you take Enspryng, tell your doctor if you are pregnant, think you might be pregnant, or plan to become pregnant. In regards to having more than one autoimmune disease, there are no specific studies designed to assess Enspryng in patients with more than one autoimmune condition or for use in combination with other medications for such diseases. As such, patients with more than one autoimmune disease should talk to their doctor about their specific conditions and what treatment might be right for them. That being said, Enspryng is not contraindicated in patients with other autoimmune conditions. And in fact, there were 31 patients enrolled in the Enspryng studies with concomitant autoimmune diseases. And these most commonly reported autoimmune diseases were Sjogren's syndrome, systematic lupus erythematosus. And in those NMO patients with concomitant autoimmune diseases, Enspryng demonstrated comparable safety and efficacy to the overall study populations.
Thanks for that info, Tiffany. And then lastly, but of course not least, you did cover some of the programs that Genentech has for providing access to patients, but could you just say anything else about what assistance programs there might be for patients to access Enspryng.
Absolutely. So as I mentioned earlier, Genentech is committed to helping you get the Enspryng that your doctor prescribed. And Enspryng Access Solutions is the place to turn for answers and support. We offer a number of support services, including a patient navigator who's your personal guide throughout your treatment with Enspryng, supplemental injection training and support, and financial assistance to help with the cost of your medicine. And so once you and your doctor have decided that Enspryng might be the right treatment for you, your personal patient navigator is available to help you find assistance options so that you can help or that can help you pay for your Enspryng. And there may be options that can help you afford your Genentech medicine no matter what type of health insurance you have. And so you can reach out to a Genentech Access Solutions patient navigator at 844-Enspryng or enspryng.com and find more information there.
Tiffany, thank you so much. We really appreciate the information. We'll come back to you in a few minutes. Okay. Thanks a lot.
Thank you.